Yes, friends, very good morning again. So, we are continuing with our discussion about anatomy and physiology. The first system we discussed today is the skeletal system. You know, skeletal system is treated by doctors which are orthopedicians. So, whatever the indications, diseases of skeletal system generally are treated by expert doctors or orthopedics doctors. Those who have degree as a D ortho, diploma in ortho or MS ortho. Now, as we have discussed, every system is made up of organs. So, what are the organs of skeletal system? One is the bone. Okay, this is bone, which are hard structures, very hard structures, and these structures, bones, are together kept in with the joints we call. So there are cartilage, bones and cartilage. These are the organs of this, and the now different bones are kept in place by muscles. That we'll discuss in muscular system, but here also we can, that two bones are kept in a place by the special muscles, not muscle, the special muscles we call as ligaments, which are more fibrous, very strong, and they keep the bones intact. They are attached to the surface, and they keep them intact or in place. So bones, cartilage is nothing but between two bones there is a paddy structure which doesn't allow bones to in contact. So there is no friction, there is no direct contact, there is no friction, there is no damage of the joints of the bones. Okay. So if we see a particular classical skeletal system joint, this picture explains you. So there is a bone, one bone, and there is another bone, and in between bone, now this is the cartilage. This. So this between two bones there is a cartilage, and this doesn't allow bone to touch each other, because bony ends, when they is, there will be friction. And these are the now ligaments which binds these bones together. Okay, ligaments. And now in feet or other place there are structures here we call patella, and also there is another structure which is we call as bursa, and between these joints where two bones are there, it forms a cavity. Now you see cavity, we call this as synovial cavity, and this cavity is full of greasy material, like in a scooter there are shockers, and in shocker they fill the petroleum, this thick viscous petroleum products, like oil, thick oil. So that is what is your synovial fluid. So there is a fluid, and we can call this as your synovial membrane. So there is a synovial membrane, there is a synovial fluid, okay, and these are two bones, and these are the ligaments. So most of the joints are like this. Now what is the function of skeletal system? Basically, as we discussed, this gives the framework. You are erect, you stand on your bones, and they give support to different organs. Now internal organs, they are attached with the bones, with the special membrane, and so they give surface to attachment, that also. And the inside of the bone we call as bone marrow. Now this is the bone. So inside there is a bone marrow. Now this bone marrow produces all blood cells. All your RBC, WBC, platelets. So basic, osteoclast or the basic cell is manufactured here, and later on this differentiates. So the important role of is also that they make the bone cells. So if you give drugs which kill cells, like anti-cancer or cytotoxic drug or other drugs, then these cells are growing. So they will kill cells here also. So you will have less number of WBC, less number of RBC, less number of platelets and other cells. Okay, because this is what we call as bone marrow depression. There was a drug, chlorphenicol, a good drug for typhoid. It was used, even I have promoted long back, chlorphenicol. But one of the side effects was this bone marrow depression. So because of that, this drug was replaced. So another function of this is a formation of blood cells. And all the calcium and minerals of your body, they are stored in bones. Calcium, phosphorus, magnesium, all minerals are stored here. That is what gives bone strength. They are like the columns, pillar. When you make a tower, in Bombay we have 30 or 10 floor. So they make columns, and these columns are reinforced concrete with iron, very strong. You can't break. So similarly, in bones, there are minerals which are stored. And if you don't take in your diet enough minerals, bone give the minerals. And this is how bone become weak, more fragile, more propensity or more chances for fracture and dislocated fractures. So that disease we call as osteomalacia, when bone becomes soft, or osteoporosis. Then because if this calcium goes, there is a pore, there are cavities now. There become cavities because mineral has gone. Now there is an empty space, cavities. Osteoporosis, pore. Pore means hole or cavity. They become, particularly in females in old age after menopause. Osteoporosis is a problem because the female sex hormones, they keep bone strong, and when the menstrual cycle stops, they are more the problem they face. So in bone, there are minerals are here. So bones basically give support, they produce cells. Another very important, they also protect your organs by making cage. For example, my brain, you see. So there is a cranium, you can't touch, nothing. It is bone, complete bone, nothing can enter. So by making a bony box, they protect my brain if I fall. Now when you ride, you put a helmet. So helmet is another cranium, outside artificial cranium they give it. Like artificial intelligence, they give artificial cranium. So if you fall while driving, the helmet will protect you. So this brain will not, this cranium bones will not, brain box will not break. So by making a box, okay, they protect also by making a cage. Now this thoracic cage, there are ribs here, and in ribs my heart, my lungs are protected. Otherwise somebody, if there is no ribs, anybody can come and punch in your heart and you die, or he takes hand and just squeeze your lungs and you instant death. So God has protected you. They say no, vital organs are your heart, your lungs, and part of your stomach also, is covered by this thoracic cage. So this protects. Okay. And they also protect by making the canal. In vertebral column, in vertebral column, inside there is a hole. and in that your spinal cord which runs right from the last part of brain to the end. So this spinal cord runs there. So it is protected. If there is a prolapse, if two vertebral column, they prolapse, it falls on this. We call vertebral prolapse. Now there is a pain. And this pain is not treated even by NSAID. It is neuropathic pain. So, if two vertebrae they collapse, vertebral disc collapse, it is a serious disorder. And there is a pain in spinal cord. So, bone also protect our vital organs like brain, spinal cord, like heart and lungs. Okay, and in female, they have a special girdle. So where uterus is protected. So uterus and part of female genital tract are protected in that. So they protect it. Okay, friends. So remember that they also play a very vital role in that. And I think the last function, which is, I already told you, is a storage of calcium and minerals. So skeletal system has these organs. Doctors are orthopedic. Now diseases will be simple. If there is a joint pain, this is called arthur. So it will be arthritis. Itis, you remember? Add itis, itis, wherever you are. So joint inflammation of joint will be arthritis. Joint of muscles will be myositis. Okay, myositis. Softening of bone will be osteomalacia. Tendon, we have discussed, tendon, ligaments or tendons, they are also called as tendons. Now inflammation of tendon will be tendinitis, itis. So synovial fluid, synovitis. If synovial fluid and tendon both are inflamed, this also, this will be tenosynovitis. Tenosynovitis. And okay, now drugs, there are drugs which can replace synovial fluid. They inject drugs in the joint directly. Viscous, like hyaluronic acid, they give it, and this is a drug used, very expensive, 20,000 rupees, $300, $400 for one injection. Arthritis, they give it. Okay. Then arthritis. Now there are different types of arthritis. If it is age related, we call as osteoarthritis. Osteoarthritis. It is generally age related because of use of bones and tear and wear. The joint, they are damaged. Okay, and this is what is your osteoarthritis. But in young age also, small children or anybody, due to your disturbance in immunity, there is also arthritis. So your immunity, which is supposed to protect you, acts against you. That is what is autoimmune disorder. Remember it. Autoimmune disorder means disorder or diseases which are due to your immunity, which is supposed to protect you but kills you. Okay? So rheumatoid arthritis is an autoimmune disorder where own immunity, which is supposed to protect your joints and bones, damage it. That is what, there is a test also, rheumatoid RH positive or R positive. Doctor will do the test. Is it rheumatoid or non-rheumatoid? Rheumatoid, the treatment will be different. Simple. It is autoimmune disorder. So immunity you kill. Suppress your immunity. So they will give immunosuppressants. For example, methotrexate, which is basically anti-cancer drug but used in rheumatoid arthritis. Tablets 2.5 milligram. They give it 2 or 3 or weekly or twice a week. There are different protocols. Okay. So rheumatoid arthritis. Osteoarthritis is age related. Nowadays, if there is a damage of the joints and you don't want to take drugs, then they will do total knee replacement, TKR. They will replace it. So they will put a plate here, they will put a joint here, and they will insert in the bone, and in between there is a pad is coming. So you have a freedom permanently from joints. So there is a knee replacement surgery, hip replacement, femur, which is going into the girdle. If there is a pain there, they will cut it and replace artificial, the socket there inside, and do hip replacement, knee replacement surgeries, and many others also. Road, they put a road. If your bones you cannot repair, there is a total damage, fracture, they will put artificial road also. Because ultimately I told you, what is the skeletal system? It is nothing but the column and the beam of the building. So put artificial column, what can you do? Okay, so these are the functions, and these are the diseases. Remember, one more disease you should know, that is very important, you should know, is gout. G-O-U-T. Gout or gouty arthritis. This is also inflammation of joints, but due to accumulation of uric acid, particularly in the feet, in a toe, great toe. In the feet, in great toe, it gets accumulated. And those who use too much protein, so high proteins, and cannot metabolize the protein, and creatinine level is very high, then these crystals gets accumulated in the joints, and then they causes problem. It is generally disease of, I think, rich people, those who have more, they eat more of proteins. It is gouty arthritis. Those who eat, so doctor will say don't eat protein, no chicken, no mutton, no high protein diet for them. Okay, so this is the skeletal system. Doctors are orthopedics, and drugs, what generally simple. Nobody goes to a doctor if there is a pain. So generally these are the best doctors for anti-inflammatory drugs. For analgesic, non-steroidal anti-inflammatory drugs, these are the best doctors for you. Okay, these are the best doctors for any NSAID, anti-infectives, because when generally they do some surgeries. So anti-infectives, antimicrobial, NSAID, immunosuppressants, and all the medical devices like which are internal fixation and all. So these are the good doctors as orthopedics. And important thing is, orthopedics are, once they prescribe, they don't change the drug, because patient is stable. Okay, so with this our first system, we have covered skeletal system, and in next video we'll discuss the muscular system. So I hope those who are non-pharmacy, non-science graduate, this will give you some idea. Now read it more and more on internet, on books, there are information, read it. But this is just for you to refresh. Okay, so thank you very much. Have a good time.